Today's video is about when you have a prostate enlargement, benign prostate hyperplasia, or enlarged prostate prostatitis, and then it causes urine to back up into your kidney, causing kidney damage or chronic kidney disease. That's what today's video is about. Thanks for watching, everybody. If you're new, welcome. Make sure to subscribe. If you've been here before, welcome back. So this happens in a lot of people with kidney disease. It's older men, which this happens to. It's not one of the more common causes of kidney disease, but it's something that a lot of cases every year happen because of this. So as men get older, it's very common, above 50, that your prostate can enlarge. And in some cases, it enlarges so much, or you get so much inflammation there, that it blocks the urine retention, which can't flow from the bladder. So it builds up in the bladder, which backs up into the kidney, causing damage. And the longer it stays there, the urine, the longer that blockage is there, the more damage to your kidney. So if this is happening to you, make sure to get medical management right away, because there's a lot of procedures you can do, and I recommend taking the medications, because when you have this type of damage because of urinary retention, because of urine sitting in your kidney, which shouldn't be, you can't recover it after a certain amount of time. So you want to do everything you can, including proper medical management. Okay, so aside from that, there's a couple things you can do on your own dietarily to help shrink the prostate and protect the kidney. I'm going to give a couple of recommendations here. So one of the first ones is having less trans fats or oxidized fats in your diet. Now, trans fats, they come from pork, they come from red meats. They're found in small amounts in a variety of foods: milk, butter, lard. Let me see some other sources here. Lamb, okay, one of the main ones. Beef and pork, which I mentioned. So you want to keep those foods low. You don't want to have a lot of them in your diet. And they're also harder on the kidneys. So you're benefiting two things: your prostate and your kidney, by avoiding or minimizing a lot of those foods. Trans fats also come from food cooked with high temperatures. So like barbecuing, where you actually see the blackness on the food. That's trans fats that's been oxidized, so that's a really bad one. Trans fats also come from packaged foods. Okay, so a lot of baked goods, your pies, cookies, cakes, donuts, any type of packaged junk food. It's all going to have trans fats and healthy fats, which are bad for your prostate and bad for your kidney and bad for your health. So you want to minimize those and instead include vegetarian or vegan sources of proteins: lower fat chicken, turkey, beans, soy products. Okay, so you want to have more of these sources of protein in your diet. And we're not discussing protein and kidney disease here, so you determine whatever protein amounts, but you just want to avoid those foods. Now we're going to talk about a couple supplements which have shown to help the prostate and support kidney health. So one that I've mentioned before is omega-3, okay, omega-3 fatty acids with a high EPA, okay, that's the therapeutic part of the omega-3. So we have other videos that break this down more further. They'll be in the comment section. But you don't want to go to the store and just buy any omega-3, even though it sounds like it might have a high amount, where you read the label, it says 1,200, 1,500 milligrams. It's not what we're looking at. We're looking at the EPA. You can see that on the back and how much is in there. Liquids have higher amounts, so they tend to be easier. And so what I recommend for prostate issues, which will also benefit your kidneys, is 1,500 milligrams of EPA. That's 1,500 milligrams of EPA. Okay, very good. Next is CoQ10. I also have another video about CoQ10. It's super antioxidant, so healthy for the kidney and your prostate. At least 200 milligrams per day. You can get a 200 milligram pill once per day. And the last one is zinc. Okay, it's shown that people who take extra zinc with an enlarged prostate will reduce the size and the symptoms over time. So the zinc, generally recommend about a 30 milligram pill twice a day. So it's a 30 milligram zinc pill twice a day. You don't want to buy zinc oxide. It's not the form you want. It doesn't absorb well. Pretty much any other form is okay. Zinc citrate, zinc gluconate, zinc picolinate, all going to be okay to use. That's 30 milligrams twice per day for 6 months at most. You can do it long term, but you're going to need to take a little copper on and off, because long-term zinc begins to lower your copper levels. So those are the three supplements with the dietary recommendation. Omega-3 with a 1,500 milligram EPA, CoQ10, 200 milligrams or more per day, and then the zinc, 30 milligrams twice a day for 60 milligrams per day. Plus the dietary recommendations of reducing those foods I talked about or just completely eliminating them from your diet. So a couple things that you can do if your kidney issues, your chronic kidney disease, acute kidney damage is caused by an enlarged prostate and urinary retention. Thanks for watching, everybody. Lots of other videos, so much you can do to support kidney health. We'll see you soon. Bye.